Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A client is admitted to the recovery room after cystoscopy with biopsy. Before the nurse can discharge the client should be sure the client 1. Has a bowel movement. 2. Has received the first dose of pain medication. 3. Has voided. 4. Has no blood in the urine. The correct answer is 3. Has voided. The nurse should verify that the client has voided prior to discharge in order to evaluate bladder function. Bowel function is not expected to be affected by this procedure. There may not be a need for pain medication immediately post-procedure and before discharge, but the nurse should assess the client's pain status and inform the client about the use and side effects of the medication. It is normal for the client to have hematuria because of the procedure. The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer.
Which one of the following children is at most risk for sudden infant death syndrome? 1. Infant who is 3 months old. 2. 2-year-old who has apnea lasting up to 5 seconds. 3. Firstborn child whose parents are in their early 40s. 4. 6-month-old who has had 2 bouts of pneumonia. The correct answer is 1. The highest incidence of SIDS occurs in infants between ages 2 and 4 months. About 90% of SIDS occurs before the age of 6 months. Apnea lasting longer than 20 seconds has also been associated with a higher incidence of SIDS. SIDS occurs with higher frequency in families where a child in the family has already died of SIDS, but the age of the parents has not been shown to contribute to SIDS. A respiratory infection such as pneumonia has not been shown to cause a higher incidence of SIDS.
A client has undergone a cystectomy and an ileal conduit diversion. What should the nurse incorporate into the discharge instructions? Select all that apply. 1. Drink at least 3,000 milliliters of fluid each day. 2. Minimize daily activities. 3. Keep urine alkaline to prevent urinary tract infections. 4. Avoid odor-producing foods such as onions, fish, eggs, and cheese. 5. Wear snug clothing over the stoma to encourage urine flow into the drainage bag. The correct answers are 1. Drink at least 3,000 milliliters of fluid each day, and 4. Avoid odor-producing foods such as onions, fish, eggs, and cheese. An adequate fluid intake aids in the prevention of urinary calculi and infection. Odor-producing foods can produce offensive odors that may impact the client's lifestyle and relationships. Lack of activity leads to urinary stasis, which promotes urinary calculi development and infection. Acidic urine helps prevent urinary tract infections. Tight clothing over the stoma obstructs blood circulation and urine flow. The nurse is teaching a diabetic client using an empowerment approach. The nurse should initiate teaching by asking which of the following? 1. How much does your family need to be involved in learning about your condition? 2. What is required for your family to manage your symptoms? 3. What activities are most important for you to be able to maintain control of your diabetes? 4. What do you know about your medications and condition? The correct answer is 3. What activities are most important for you to be able to maintain control of your diabetes? Empowerment is an approach to clinical practice that emphasizes helping people discover and use their innate abilities to gain mastery over their own condition. Empowerment means that individuals with a health problem have the tools, such as knowledge, control, resources, and experience, to implement and evaluate their self-management practices. Involvement of others, such as asking the client about family involvement, implies that the others will provide the direct care needed rather than the client. Asking the client what the client needs to know implies that the nurse will be the one to provide the information. Telling the client what is required does not provide the client with options or lead to empowerment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is instructing the client with hypothyroidism who takes levothyroxine 100 micrograms, digoxin, and simvastatin. Teaching regarding medications is effective if the client will take 1. Synthroid with breakfast and the other medications after breakfast. 2. Synthroid before breakfast and the other medications 4 hours later. 3. All medications together 1 hour after eating breakfast. 4. All medications before going to bed. The correct answer is 2. Synthroid before breakfast and the other medications 4 hours later. Synthroid must be given at the same time each day on an empty stomach, preferably 30 minutes to 1 hour before breakfast. Other medications may impair the action of levothyroxine absorption. The client should separate doses of other medications by 4 to 5 hours.
Several nurses complained to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the aides personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option.
The nurse should assess a client with hypothyroidism for which of the following? 1. Corneal abrasion due to inability to close the eyelids. 2. Weight loss due to hypermetabolism. 3. Fluid loss due to diarrhea. 4. Decreased activity due to fatigue. The correct answer is 4. Decreased activity due to fatigue. A major problem for people with hypothyroidism is fatigue. Other signs and symptoms include lethargy, personality changes, generalized edema, impaired memory, slowed speech, cold intolerance, dry skin, muscle weakness, constipation, weight gain, and hair loss. Incomplete closure of the eyelids, hypermetabolism, and diarrhea are associated with hyperthyroidism. A 60-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? 1. Tachycardia. 2. Weight gain. 3. Diarrhea. 4. Nausea. The correct answer is 2. Weight gain. Typical signs and symptoms of hypothyroidism include weight gain, fatigue, decreased energy, apathy, brittle nails, dry skin, cold intolerance, hair loss, constipation, and numbness and tingling in the fingers. Tachycardia is a sign of hyperthyroidism, not hypothyroidism. Diarrhea and nausea are not symptoms of hypothyroidism. Which of the following medications should be available to provide emergency treatment if a client develops tetany after a subtotal thyroidectomy? 1. Sodium phosphate. 2. Calcium gluconate. 3. Ecothiopate iodide. 4. Sodium bicarbonate. The correct answer is 2. Calcium gluconate. The client with tetany is suffering from hypocalcemia, which is treated by administering an IV preparation of calcium, such as calcium gluconate or calcium chloride. Oral calcium is then necessary until normal parathyroid function returns. Sodium phosphate is a laxative. Ecothiophytate iodide is an eye preparation used as a miotic for an anti-glaucoma effect. Sodium bicarbonate is a potent systemic antacid. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.